All right, I want to talk to you about fabrication of the DASS, D-A-S-S Dynamic Adjustable Stretching System KOs and KAFOs. And this is also going to be similar to the elbow splint, but we'll talk about that on a separate video. This is the DASS component attached to the knee joint that we have laterally. So this is a stretching KO. It's got the dynamics of the component there, which is adjustable with this ratcheting lever here to increase the extension, and still has the dynamic tension to it, but it has the ability to increase or decrease the amount of tension on it to make it tolerable for your patients. We have this pretibial shell, which provides the 3-point pressure system, and while we're creating the stretch, we're pushing up on the back of the calf, pushing up on the back of the thigh, and down around the patella. We do have it relieved right at the patella with a soft material, typically Alliplast or a puff material, and then a pretibial shell just below the knee, and another one similar just above the knee to provide that 3-point compression. And it is all dynamic because it sort of flexes with the soft material at the knee center, so even when it bends, it's going to follow the patient's leg wherever that goes, and that soft material will allow that to be like a natural hinge right through the knee center. So as far as fabrication, a couple things. So with the DASS component itself, very important to attach it this way. So the elastic band is riveted up this top section up here on the thigh, and the strap with the numbers on it is attached to the knee joint. If it's the opposite way, the rotation of the knee in through here tends to twist this band, and then it will break because it doesn't have a straight pull on it. So make sure you put it this way. This will attach with just a speedy rivet up here at the knee center. This is just a standard 8/32 screw. What we do is put the screw through, I'll show you on this joint. So what I recommend is just a 1/4 inch by 8/32 screw that we put through from the back side. And this is a 3/16 inch barrel that's going to go through the slot on the DASS strap. And we'll tighten that up, and you just tighten it until that barrel bottoms out on the metal of the joint. That way it will be tight against the joint, but still have slack for the joint to slide in that slot, which is really important to make sure we don't inadvertently tighten the joint if there's just a little bit of movement. So it allows for a little bit of movement at the knee center here without tightening the joint, and then as you click it up here, you're going to go to a higher and higher number. Another thing that's really important is we have a flexion limit screw down here. So this brace is set up, there's 2 possible configurations of this DASS band. So there's 2 different places that you can attach this DASS band on this joint. The first one is for more severe flexion contracture. So I've got it in this first hole here on this one, and on this one here on the actual knee brace, I've got it in the second hole. So you use a different hole depending on how severe the contracture is. So this first hole here is only for more severe contractures. You can see we're right about 90 degrees here. So if you have a contracture of between about 45 to 90 degrees or more, then you'd want to use this configuration right here and attach it onto this hole. If it's less than about 40 degrees, then you're going to go and move this attachment to the second hole, because that will go from about this position of about 45 degrees. And then as we crank it all the way up, then we get fully to full extension. There's an automatic extension limit on it, so it will not go beyond full extension. So with the first hole here, that is turned all the way up to number 8. So we go from about 90 degrees up to about -30 degrees. The second position here, where we move to the second hole, is going to go, if we release the tension, we're going to easily get to 45 degrees or so of flexion, and then it will ratchet up and go all the way out to full extension. As far as this pretibial shell, we have plastic formed just around the patella essentially, and these 2 straps we want fairly close to the knee center, because these are going to be pushing down on the knee itself to help create that 3rd point, pressure point for creating that extension assist. And we want the straps to come roughly across the middle part of the shell. You can see how I have that. If it's too far towards the knee or too far down here, it's not going to give the same pressure distribution. So close to the center of these 2 shells, with the opening here being just right around the patella. And as far as the attachment of straps, we need to have the straps attached on the lateral side so that it doesn't get in the way of this band. So it will come underneath the band through the shape here and then reattach to the lateral side. That's the best way to make sure it doesn't interfere with this. If you attach them medially and put the shapes laterally, then you have to try to fish a strap in around through that, behind that joint, in order to get the strap attached to the shape. So rivet the straps laterally, put all the shapes medially. This screw right here is real important. This is a flexion limiting screw. Our recommendation is that we always have a flexion limit in here so that we never overflex the brace beyond a certain point. That'll help make sure that it doesn't put undue stress on the brace, so that someone doesn't inadvertently flex it all the way around beyond where a normal movement would happen. So whatever the patient's contracture is, if it's, let's say, 30 degrees, just like that, then we usually recommend giving at least 40 to 60 degrees of extra movement so that you can easily get it on, and in case the patient needs to flex and move their leg, then they can have some freedom to do that. But then as they stretch it more, we'll go back towards that.